Welcome, audience, to another bi-weekly episode of Fixing Healthcare from the Trenches, a podcast designed to really bring awareness to what our healthcare challenges are. And today's actually a very special day because typically we've interviewed clinicians, people who are in the trenches, but we decided to speak with a patient of mine on several different occasions. So we were going to bring to light some of the challenges in workers' compensation. So he's going to tell his story, and then he became a patient again outside of workers' comp, right? With regular commercial insurance, which had its challenges as well. And then now he's a patient again because you got into a car accident working or no?
Yeah, I was at work.
You're at work, yeah. So I bumped into him in a hall at the Ortho Now Rehab facility a few weeks ago. I said, you know what, we should have you podcast because I want to say that he also received an award. It's actually the second time I've gotten the award for the injured worker. So it basically profiles somebody in the state of Florida who went back to work after a very significant injury. So he went up to Orlando to get the award, and I think it's just tremendous. And, we'd love to see a lot more attention to that, particularly, with the challenges right now, with the police officers and all the public. I mean, they need to see all these good stories, and there's a ton of them, a lot more than the bad stories, that's for sure. So Officer Ramirez has been on the now with the City of Miami force for 13 years. He's been a motorcycle officer, and he had an unfortunate accident with his partner.
Yes.
So and those of you who want to kind of see the video we got a little clip of the accident. It was probably traumatic for you, but he's very open to educating the public about what happened and what we can do to improve our system. So welcome to the show.
Thank you for having me.
So what happened that day? Tell us.
So that day we were actually working a police funeral where we buried one of a local nearby jurisdiction that had an officer who passed in a car accident as well. We finished the funeral, and at that time I was on my way back to our police headquarters, and this vehicle just turned in front of me as I was traveling.
With your partner?
With my partner, yes. I was. It was a distracted driver. And she just made a left-hand turn in front of us while we had the right of way, and they threw me over, destroyed both motorcycles. 7 fractured ribs, my broken collarbone. I had minor bleeding in the brain, and a torn ligament within the thumb. Thankfully, you were able to take care of as well too. So
then they took you to Jackson, right? Which
yes,
which I want to give a shout out to. It's one of the I trained at Bellevue in New York. It's the same thing. It's one of the if I have a severe injury, please take me there.
Yes.
Okay.
We actually have stickers in some of our police cars that say, if I get injured, take me to Jackson Trauma. So the trauma team over there is phenomenal. I've been there a few times, so they're on point and they know what they're doing over there.
Yeah.
And we also see what they do when a patient comes in from suffering other gunshot wounds or any other type of trauma.
Yeah, it's a polytrauma.
Yes.
So you were, but once you got cleared in terms of the head injury, thank God wasn't that severe, and you had a pretty displaced clavicle, right? Collarbone fracture.
Correct.
Left, and you had continued pain in the thumb. So you were in the hospital a while, but then what happened there? Because at that point, right, we should be talking about treatment.
Absolutely.
What happened?
So at that point, I got discharged and was following a prescription medication regimen and told to be on bed rest, especially with the fractured ribs. But it wasn't until I had to continuously call workers' comp and follow up with the hospital to see what it is, where's my next step? What am I supposed to do? Because I still feel a lot of pain in my thumb. Who am I supposed to see? So the next step was, I need to go see a workers' comp clinic, where at that point they would do an entire evaluation again and take it from there and then see where it is that they refer me to. So that didn't happen until I started inquiring. And we're talking about 3 weeks after I got discharged that I was dealing with this.
So you were in a world-class trauma center. Obviously, I know the colleagues who were very good, who could have put a plate on your collarbone, could have fixed the, I know the hand surgeons there, but it's more a problem with the system, right? Obviously, because So I remember when I saw you, it was almost 4 weeks out.
Yes.
And you had kept asking the work a cop doctor, which obviously is a generalist, right? It's a
Right.
usually family practice physician
Yes.
that works kind of shifts in these health centers, but they don't know orthopedics. You can't expect them to. So they don't know which collarbones can heal conservatively or which ones need to be fixed.
Correct.
Right.
Absolutely. And I think that delay is what affected it too, since I did go back and see the x-rays from trauma because I was a little concerned that I was released with a displaced collarbone fracture, but it was actually, it wasn't displaced. It got displaced after the fact since there was such a large delay.
Oh, wow.
Nobody was able to see it until 4 weeks after that. You came in and you did a whole full screen of even, things beyond, hand and shoulder. So that's when you saw, hey, and you put me in surgery literally the next day. So
next day, yeah, we did, which was unusual. We did surgery on both sides same time, but the name of the game, right, has to be efficiency. We have to worry about healthcare costs. So, for me to take you to the OR, plate the left clavicle, and then a different day fix the thumb. I just said, as long as you're the right kind of patient, which you were, do you mind, being inconvenienced a bit?
Yeah.
And you did great, right? You did great.
Your mission to me was, hey, we knock this out now. Your recovery will be this date, and effectively that date I was discharged. So,
but that whole process could have been a whole month earlier. And
Absolutely.
I think what the public needs to understand, and my God, I mean, if anybody listening is say an employer, a big company, I mean, think about this. How do your injured workers get cared for? Because when it's not done efficiently, right, waiting a whole month, that's a whole month of medical bills that are being generated and delaying the month of you coming back to work.
Correct.
Right.
And that's service that's not being provided to the public, at least in my aspect.
Absolutely.
The department is down one officer. So,
Right.
and that one officer makes a big difference and when it comes to our minimum staffing numbers and stuff like that. So,
that's a national problem, isn't it, with
Yes.
the police? I remember reading in Topeka, Washington, there's a major problem with that. Crime is down, thank God, because they're not, no pun intended, but they're not handcuffing the police as much anymore, thank God. But they have less officers. So when something like this happens to you, it's, every week counts. You're out. And same thing if you're in construction, right? In Miami, there's a ton of construction.
Absolutely.
And you wouldn't believe how many folks I treat. And there's this huge delay. I'm thinking, wow, that company is out their best sheetrocker, their best framer, right? Their best, plumbing guy for weeks and weeks. So I the question is, what can we do to bring attention to this? Because we live in a country, right, with really, really exemplary healthcare. I mean, it's not that, it's the system, right? So you recovered, you went back. There's a nice video. You're riding the motorcycle, and then you got this award and went to Orlando.
Absolutely. Well, thanks to you and your team. We were selected, and it was amazing going up there. It was a great experience, and I'd do it again.
So what I was curious about is I've mentioned several times, because I think let's just say public relations, image, perception is so important in our society, especially more now. That did you feel like that the city or even the department talked about the fact that you came back to work after such a severe injury? Because a lot of people kind of malinger. I mean,
yes, they do. But at least they did not expect such a fast recovery based on the injuries I sustained. I was technically ready to get back within 3 months, and we after the X-rays, you wanted to give it that extra month just to make sure the bones were fully healed, and that extra month did help because I felt more movement and range of motion. So if I wanted to give it 3 months, 3 months for all those injuries was, to me, great. They expected I was going to be out a whole year. They didn't even think I was going to get back on the motorcycle, but based on how I was feeling after the quick recovery, I was ready to get back on.
Yeah, and it often happens again because you saw the delays for you to get that initial care, and then even once you've had the care, there are delays. So this is the thing we have to work on, and that's the reason for this podcast. So anybody who's listening, please, reach out to us, and what ideas do you have to make this better? Because it's not that it's changing, right? I told you the other day I saw by coincidence 2 police officers, same department. One guy had he also was a motorcycle, and he had this road burn, you guys get it. And but his elbow, all I needed to really clear him was I needed an MRI because I was worried about a ligament. And so the X-rays, he had a minor fracture, but I wasn't worried about that. I was worried more about the ligament. And I could tell you, he sat around with his wife for about 2 hours, and we couldn't get the authorization.
Wow.
If I had the MRI 20 feet away, right? I mean, my MRI is through that wall. What is the problem? If I can do that study, just like an X-ray, right? We don't send people out nowadays for an X-ray, but if an office invests the time and money to have an MRI magnet, let's just get it done.
Especially if they're already saying you're here.
Yeah. So that we get again, handcuffed, hogtied by this authorization process. Correct. And it's a shame because now I don't know where he went to get the MRI.
And that's the problem there, that you have all the capabilities and software and programming and equipment to get that done, but now they want to go and see who they have on rotation, who's an approved vendor to do the MRIs. And that's where I think the delay comes in, because now they have to send them off to get it somewhere, where the MRI comes out cheaper, Well,
the irony, it's not that, because nowadays insurance kind of dictates that. So it's not much of a cost comparison, except for our self-pay patients, which we see a lot of. And we're able to work with them. But, time is money. So the fact that he has to go somewhere and get the MRI, now come back and have you see it. Yeah. That's where the delay is to getting him back to work. That's true. And this is what we want to change. And then there was another officer on Monday, and I don't recall what it was, but it is very frustrating for me and my staff, because we see this and we say we want to work. I mean, I met with the mayor and I said let's work together to improve this. And there's a huge economic consequence. I mean, you should care anyway, right? Yeah, because absolutely. Of this is people's livelihood and healthcare. But let's just move past that. Let's just talk about the economics. And in this country, it's now 20% of our GDP. We are twice as expensive as the next industrialized country on the list of healthcare costs. And it's very obvious to those of us in the trenches why that is. It's because there is this bureaucracy, and there is this just the authorization problem alone is a big deal. So then you were doing fine. You were back at work, and then you came in one day. Yeah. And I think you came in. Did you go to Ortho now?
Yes, I did go to Ortho now. Yeah. So I suffered an injury to my left hand, which is the same hand that I had the clavicle fracture. I fractured now 2 fingers, my middle finger and my ring finger on my left hand, non-work related. So I was able to see the other side of not using workers' comp. And literally I walked in because I already knew, that the injury that I had, I needed to go see a hand specialist. Immediately as I walked in, they say, hey, let's get some x-rays done. And immediately we were scheduled for surgery.
So if those fractures had been minor, and unfortunately most of them are, they would have put the right immobilization treatment. You wouldn't even have seen me. We're buddies now, so you would have showed me the x-rays, but I would have agreed with the ortho now clinician. But in this case, it was very obvious to that clinician that this needed to be fixed. So we scheduled you within days and you have a couple so show your hand. We have a couple mini. Yeah. One of them was much worse than the other.
The ring finger.
Yeah. But you've got good function. Yeah. And again, that has an economic consequence, because if you were not referred to really the right person for this, think about how long you'd be out of work. So these are things that we have to think about as a society, and that's what our goal is. So you so you have to go, when you went out, you went out a network, right?
Correct.
Right. Yes. With me, because I don't make any apology about this. If you look at what the surgeons, I can't speak for my poor primary care colleagues because they're really getting killed. But, even us, I mean, what they're paying in network to do some of these surgeries, it's just absurd. I mean, I say it all the time, my jet ski mechanic does better. That's my, because it's really, I just had it redone. My son's 14, and so you can imagine. Yeah. So we had to redo it, and it's just amazing, those costs. And, you look at our overhead here, right? Because it's not, it's not just what you're reimbursed for the surgery, but it's what your cost is to run a practice. So you did well with that, fortunately, and then now you're being seen for a couple.
Yes. So that's
minor spine.
So that's the beautiful thing about having everything under one roof. Meaning, I'm next door getting physical therapy done. I was involved in a vehicle accident. Again, 4 fractures to the ribs, cervical spine sprain, fractured sternum. So I've with all the therapy I've been getting, I've been recovering.
So in that case, I mean, a fractured sternum and ribs, I could understand. In this case, I could understand if the work comp said, well, no, we really want you to be seen at a hospital or something.
Correct.
So, yeah, but you ended up coming pretty promptly to ortho now after that, or what?
Well, because I pushed.
You pushed.
I pushed, and I was like, hey, and I think, and what helped in this case is that I have a history coming to ortho now, so it's like, oh, well, it was able to get approved. But if a patient doesn't put in that legwork, it won't get done.
Yeah. And that's a problem. So, again, we want to meet. I mean, I've done it. I've met with administration. I'm not sure why something doesn't change. Maybe it's just that the process isn't understood.
Correct.
And but we're here to keep explaining. I mean, ortho has been open 13 years, so it's not like
It's a phenomenal concept. I think if everyone were to go into that direction where they can walk into one place and get everything done during one facility, or even if it has to be referred out, but at least you went to that one place that handles and knows everything, and you got all the right practitioners in here, clinicians. I think it's the way to go.
And it's it's happening, but it's just slow acceptance, and whether it be the public and particularly the insurance industry. I try to tell insurance industry is that we actually save you money, right? I mean, and they still don't really get it. There are different types of, there's cardiac centers now open, walking in, there's women's centers, there's pediatric urgent care. Because if you go with your kid to regular urgent care, a lot of the more subtle things in kids, the adult physicians don't understand that. That scares me. The kids with with croup or something. So and not only is there a healthcare consequence, but obviously the cost. So, knowing all this and what you've been through, what would you say? We ask our guests, what would be 3 basic things that you would try to get instituted to improve our healthcare system?
Well, that first and foremost would be I've been noticing in the few clinics that I've gone to, patients they've had appointments very prolonged. At least not here. You see your patients pretty promptly. Everybody knows that on Mondays you're doing Tuesdays you're doing surgery, you're showing it on live, but sometimes people are trying to see specialists and they won't get an appointment until 2-3 months down the line. And that's what I've been seeing and hearing from I personally haven't experienced. The only experience I had was having to see you almost 4 weeks out after my injuries, but
so a lot of times it's a backlog with the practices, right?
Correct.
It's not, so and then this is the thing the public needs to understand. I mean, there is going to be a shortfall of 140,000 physicians in this country in the coming decade. So this is, we've grown in population, right? And yet we haven't kept pace with that. Fortunately, our mid-level colleagues, like Kate, my PA, who's phenomenal. She knows more hand than my colleagues who do, spine, and their PA or nurse practitioner knows more spine than I know, right? Because they're doing that every day. So we have to really get people to the right clinician. So number 2 would be?
Number 2, and I think that's just a nationwide, the cost of insurance premiums and prescription. I know we do have several entrepreneurs that are trying to take over that issue, at least in the prescription drug costs, reducing.
Mark Cuban is.
Mark Cuban,
By the way, I've tried to reach out with him with Dr. Drew. I've been on the Dr. Drew show twice, and but that'll
be great. And I know, from what I've been hearing and seeing, it's it really is helping out, and that's what some of these entrepreneurs are doing with their funds and their knowledge and capability of helping out the public.
Great. It is getting better. We saw that there was a bill passed for Medicare in terms of particularly for insulin, which is so vital. I mean, if people don't get their insulin, the costs, the healthcare costs down the road of renal or kidney failure and eye problems, are catastrophic. So, all right. So number 3.
And number 3 is trying to, and I think we touched a little bit on the first issue, is trying to get or motivate our educators to see if we can have a higher, I guess, people studying or students studying these practices, because what's going to happen? Look, we have a shortage now of pilots. So what's going to happen when, we have a shortage of clinicians and doctors and practitioners? What do we fall on? Where is the practice going to, and what are we going to do?
You mentioned it already. It takes several months. I know that all the time, because my practice now, because I'm out of network, I can see now the public has to understand that, things, there's no free lunch, right? You want to see a good, you want to see a really good plumber, you're going to pay a bit more. Certainly an attorney, I can tell you that. And the public has to realize that the healthcare has a cost. So you have to say, well, my hand or whatever area it is worth something to me. And the public has to realize that the insurance company is not really going to take care of you, unfortunately. So we're going to see changes. So my three are and you've alluded to this, the right clinician at the right time. Yeah. So that saves a lot of money. If you see the right type of doctor or nurse practitioner, what have you, who really knows that area, you're going to save a lot of money and time, right? And you're going to get a better outcome most of the time. All right. Number two is, I say this all the time, is the authorization thing's killing us, right? What I need is oversight. We need oversight, not authorization. So when I saw your colleague, the officer, if somebody saw that I was ordering MRIs on every single elbow that came in the office, then they should say, hey, Dr. Badia, we're going to look at your records. And I understand that. Good doctors would welcome that. But that's not done. So there are hurdles in every step of the way. And then the last one is what we're doing, and thank you for this, is education, public education about what the challenges are. The question is, what can we do to get the public interested? Now, I don't purport to be, to have the following of a Joe Rogan or something, right? But
we're getting,
it's just, I wonder what it is, because there's a lot of issues out there that people get very passionate about. Save the whales. I'm going to the Arctic, by the way, in 10 days. So I'm going to see whales. So I love wildlife, but geez, we gotta care about this issue as well.
Since we've met, I think that has been what you've harped on the most, and you've really taken a passion and a mission to accomplish this. And I think the whole public, I thank you, and the public should thank you for all the work that you do.
Well, one who should be thanking is us, for you keep us safe.
That's right.
Officer Ramirez, won this award, got back to work, and we need to support our police officers, all our first responders. The other day, we had an incident in our operating room, and the EMT and the fire rescue all was here in minutes, and the lady's doing fine.
Wow.
So it is an amazing system that we all have to support.
Yes.
And well, till the next one, which will not be in 2 weeks, because I will be in the Arctic.
Nice.
So I will be trying to save the whales, and a little downtime for me. But it's actually a conference, believe it or not. It's an orthopedic conference on a ship.
More knowledge.
That will be So exactly, we never stop learning.
More knowledge. So
it will be in 3 weeks, and please stay tuned. And all I ask of people listening, if you think that the comments and that the Officer Ramirez brought to light, you think these are important issues, please share it. We all like likes and stuff, but if you can share it, particularly to thoughtful people, your friends who really care about issues in our society, let them know. And the easy way to do it is just hit that little share button. Okay. So till next time. Thank you. Bye.